We're good to go, ma'am.
Hello and welcome in today's nursing webinar session. Myself Shanti, and we are going to talk about the very significant role of brachytherapy in prevention of cervical cancer. As you all know, world has been witnessing this disease condition, and it is now very high point that we should talk about it. So let us welcome our very utmost expert panelist, Dr. Suneetha Garu, who is our senior consultant radiation oncologist from Hitec unit, Yashoda Hospital. I welcome you, ma'am, and let me also welcome the Sonia, the super Sonia, the DGM Nursing from Malakpet unit, Yashoda. Yes, and just share the slide, and we are going to talk about the first slide, which is again about the prevalence. And we would like to, understand from Madam here why the cervical cancer is on rise, ma'am. As we were just looking at the prevalence as per National Institute of Health, and it is the fourth most common cancer occurs to women worldwide globally. So why this is on rise, the quote we would like to understand from your point, ma'am.
So cervical cancer is the second most common cancer among Indian women. Okay. So earlier it was the most common cancer, but as you said, like it's not on the rise these days. It has become a little bit less compared to what it was 15, 20 years back. But still, we do see some cervical cancer cases. These cases are mostly from the rural areas or where the patients have a lesser immunity, and also where the patients are, from a background where they are at a very highly sexually active women. And these are the patients who are at risk of developing this cervical cancer.
So let us see now what we have in the rest of the session. Over to you, Sonia, for the rest of the session.
Very good afternoon to all. So let's understand what is cervical cancer. But before that, what is a cervical disorder? A cervical disorder is an abnormality affecting the cervix, like cervical dysplasia or cervical polyps. Cervical dysplasia is nothing but development of an abnormal cell. Cervical polyps is a finger-like growth at the lower part of the uterus, which connects with the vagina. Now, what is cervical cancer? Cervical cancer is a malignant tumor that develops in the cells of the cervix, and it is caused by a virus known as HPV, human papilloma virus. This human papilloma virus leads to symptoms such as abnormal vaginal bleed, pelvic pain, and more.
So, ma'am, again, we would like to understand here, maybe regarding HPV infection. Many of our rural community do not understand. Is HPV a single factor for the cervical cancer, ma'am?
So HPV virus it's a small virus. Normally, this virus will be there on the surface of the body throughout our life. Okay, so it is a normal thing which can happen to anyone. So when the patient, when the girl attains her menarche, and after that, when her sexual life starts, okay, this is when the HPV virus will gain access into the uterine cavity. Okay, since the uterus, cervix is the lowermost part of the uterus, that is from where the HPV virus will gain access into the cervix by breaking the epithelium. Epithelium, or it's like a mucosal surface, which is a lining which covers and protects the cervix. So once it breaches the cervix through this mucosa, it enters into the cells of that lining. So once the cells are infected with the HPV virus, there will be some alterations in the DNA material, which will lead to development of the cancerous cells. So there is a latency period here. Okay, normally it takes up to 15 to 20 years also sometimes before we develop the symptoms of HPV virus infection, which leads to cancer. So it takes a long time. This is a very a non-virulent kind of infection. And that is the reason why we women are very fortunate to have at least the screening tests like pap smear or any kind of HPV DNA test and all. So it is very easy for us to diagnose this disease even before the symptoms start. So that's how the HPV virus will develop access, will gain access into the cervix epithelium, and then from there on, it leads to cancerous mass formation.
Can we know the various causes of cervical cancer? HPV 16 and 18 are considered to be the high-risk increased causes for cervical, vaginal, and vulvar cancers in women.
So as you said, ma'am, I mean, to reach to the latent phase itself takes a long, long time. So when we are looking at the slide where HPV 16 and 18, and we understand there are lot many other mutations as well. So is this only the single cause itself to cause cervical cancer, or do we have any other causes as well?
So basically, it is the virus which is the main predominant part, but this virus infection will be there for all the women. Okay. So any person who has developed, I mean, who has a sexual activity will have this virus infection, but only very few people will develop the cancer. So if we assess which are the patients, who are the patients who are at risk of developing this cancer, it has been found that
You want to have some water, ma'am?
yeah.
Please have some water. I think we all are having a little upper respiratory tract condition. Yes. So yes, we see, I think Sonia, in your unit also, you have nurses who assess for pap smear test, which is done in the gynae section. Yes? Yes, ma'am.
Yeah. So when we see, like, if 100 women are having HPV infection, only 4 or 5 patients will develop the cancer. So who are these patients who are at higher risk of developing the cancer? One is that the patient's immunity, body immunity is at very less levels. These are the patients. I'm so sorry today.
It's okay, ma'am. No problem.
I'm having a very bad throat.
Yes, yes.
So patients who have a low body immunity, they are definitely at very high risk of developing this. So you see, like Indian women, they don't take care of themselves. Okay. Most of the time they're busy in their work or family and all, they have least priority for their health.
And immunity is a factor which causes everything in the body, I think. Yes, ma'am, in the Indian scenario.
Then
Yes.
smoking. Okay.
Yes.
Then unhygienic sexual practice. So these are the 3 major things which will contribute to the cervical cancer.
How does cervical cancer affects women in under which age group, and what is being recommended? The age group is 21 or within 3 years of becoming sexually active. Middle-aged women of 30 to 59 years. Older age women of 60 and above 65 years. And the recommendation for them is HPV vaccination, both for boys and for girls.
I think madam will be back. And so let us also discuss, I think, this when we were talking. Yes, ma'am is here. Ma'am, if you look at the screen, and here we all would like to understand, as we know in Indian scenario or globally, worldwide, the attainment of menarche is at the very early age. So right from age 21, within 3 years of becoming sexually active, or the pubertal age, middle age and all, how far or when is your recommendation starts for the woman to go for the screening, as well as the the recommendation for the vaccination? Yes, ma'am.
So these are the textbook recommendations. Okay, these are the highest level of guidelines which say that you have to start your screening at the age of 21 years. But honestly speaking, just tell me how many of the women, like we ourselves, being an oncologist also, I don't go for that regular screening intervals. Okay, this is humanly impossible and none of us go for it. Okay, except in some countries like NHS and all. Those are the countries where you get regular calls from the from the PHCs.
Yes.
To go and take a pap smear test, because there it becomes a mandatory for them. So that is the reason why they are doing it. So WHO, the World Health Organization, has come up with some alternative recommendations. If you can go for these kind of recommendations, that is the best part. You can go for it. But for people who are lazy like me, they can at least go for 3 pap smears in their lifetime. So what it recommends is go for a pap smear at least around 30 or 25 to 30 years of age. Okay, the first pap smear. Then the second pap smear, after 5 years, go for a second pap smear. Right? And that also comes normal. Then go for a third pap smear somewhere around 45 to 50 years of age. So at least 3 pap smears in your lifetime, there will be 70% chance of picking up the cervical cancer at any point of stage. Okay. And then from there, of course, the treatment stage and all, it depends on what kind of stage we have detected and all. But these are the minimum possible recommendations which WHO has come up, and that will be the safest practice for all of us. At least the, most practical way of getting the things done.
So I would like to quote as well with you, even I am the laziest among everybody also, and we
Yeah.
all are lazy, not even, maybe first cycle I finished, and but then 2 other cycles are just pending. And also saying this, so like now, like we also often we get to see, or these kind of conversations are very common nowadays. Ki it should start from school nunchi start cheyali. We should start from them. School adolescent, the pre-adolescent girl, not like as you said, 25 to 30. So first initial vaccine should be given right only at the age of 25, man, or before that.
So yeah, this is also based on, as we initially discussed, the sexual life of the when the girl's sexual life starts. You have to catch hold of all those girls before their sexual life starts and start vaccinating them. Okay, so the best age period is the teenage age girls before they come out of their school. Okay, somewhere at 8th class, 9th class, 10th class. These are the ages where they can go for. And this is a very simple and safest vaccine. You hardly need 3 doses of vaccine. 1 dose today, 2 months after that, go for the second dose. And within 6 months, go for the third dose, and just forget about the disease at all in your lifetime. Yeah.
So if any teenage girls also would like to opt for this vaccination, but they get to see the doctor, have the appointment, and then only she can take the jab. Yes, ma'am.
Yes, yes. Usually the gynecologists, they do it on an OP basis. Okay. You can just walk into any gynae clinic. Almost all the gynae clinics are equipped with these vaccines. It is always safer to take the vaccine under doctor's guidance.
Right.
The reason is that even if you go for a simple paracetamol injection, that also has some hypersensitivity reactions, right? So this is a vaccine and it is a live vaccine. So there are always chances of developing hypersensitivity reactions and all. If it is done in a hospital under the guidance of a doctor, it will be 100% safe and you will not have any complications related to the vaccination. Yeah.
So I would like to repeat your, the say called, the teenagers should take firstly, initially she should take the vaccine, and after the gap of 6 months, and then vice versa. Yes, ma'am?
First dose is, if you are taking a first dose today, the second dose will be 2 months after this.
After 2 months?
Third dose will be at 6 months.
Okay.
So 0, 2, and 6 months.
That's 0, 2, and 6 months. Thank you, ma'am, for clearing this. This was very much required because all of us, we just neglect our reproductive health. Yes, over to you, sir.
Is it important for early detection and prevention of cervical cancer? Yes. For this, you need to do regular screening, which includes pap smear from the age of 21, HPV test, HPV vaccination, and monitoring for cervical health.
So here, ma'am, what are the, when we are looking at, as we are talking about the, steps and stages of vaccinations and all. So what are the stages or when the symptoms are indicated to a woman where she should seek the doctor's advice?
So apart from, we've been discussing about prevention of cervical cancer, screening and all. Now comes the oncologist role. Normally in Indian women, what I have seen over these past 20, 25 years is like we see cervical cancer at a very late stage, either in the second stage or third stage. Majority of the patients, they land up in third stage. The reason is that most of these patients, they'll be presenting at a perimenopausal age, around 45 to 50 years of age. Okay. So these patients, they have irregular menstrual bleeding, and most of the patients, they attribute these symptoms to menopausal symptoms. They think that, okay, it is coming back and, and it's waning off, it goes again. So that kind of psychology will be there among all the women. Even there will be symptoms, but they attribute it to menopause. So that is the reason why majority of the patients, they present to us in stage 3 disease. Okay. So the first symptom for these patients will be always a postcoital bleeding. Okay. So what is postcoital bleeding? Immediately after sex, they find that there will be some amount of blood which is coming out of their vagina. So this is something which is unusual because they must have enjoyed a sexual life for past 15, 20 years. They never had this symptom. But now also there's no pain, but there is a light a tinge of blood might come up after sexual activity.
Or kind of spotting
A spotting kind of thing. That is the first symptom. And if you have such symptom, you have to get immediately checked for your cervical cancer. So it's not that all these patients will have the cancer, but it's always better to go for it. And if you don't find any lesion there, at least take a simple pap smear and come out, and that will at least assure us that there are no cancerous cells in this patient. Yeah.
Let's now look into the role of brachytherapy. It's a type of radiation therapy that involves placing radioactive sources directly into or near the tumor. It allows to deliver a high dose of radiation.
So, ma'am, we are looking at the concept of brachytherapy, and maybe many nurses also do not know what is the use of brachytherapy in terms of providing the treatment and preventing the CC. So, what kind of therapy is this, and at what stage somebody should seek for this treatment as per your treatment?
So cervical cancer is a very unique cancer compared to all other cancers in the body. Okay, so this is one cancer which requires very, very, very high doses of radiation. Okay, around 90 gray. So this kind of high doses delivery cannot be achieved with external radiation alone. The reason being that, so for radiation, there are two kinds of radiotherapies. Okay, one is external radiation, other one is this brachytherapy, which we are discussing today. So brachytherapy is nothing but it's an invasive kind of procedure where you go inside the uterus. We are seeing that a lady is sleeping over there, and you are inserting some radioactive materials into the vaginal cavity and then treating that patient. Okay. So the advantage of brachytherapy is that you can deliver high doses of radiotherapy within the cervix, and by this you are not allowing this radiation to go into the other critical normal structures like bladder or rectum and all. Okay, so that is brachytherapy. But normally, majority of all the other cancer patients will require only external radiation, but cervix is unique because it is very highly radio resistant. It is not radio resistant, it's radio sensitive only, but it requires high doses of radiation for complete cure. Okay. So cervical cancer, if at all, if it is treated very well, even in stage 3 diseases, the chances of cure rates are 85 to 90%. Okay. So even if you are detecting a patient in stage 3 also, if you do a proper external radiation along with a good brachytherapy, then you can get at least 85 to 90% good survival rates compared to other patients like other cancers where the cure rates are very less. Here you have higher cure rates. That is the reason why a radiation oncologist always emphasizes, see, some cancers you cannot treat them. Some cancers, they don't have any cure at all. Or some cancers, they have very less lifespan. But this is one cancer, if you do a proper treatment, you have a very good results.
Survival, yes. Yeah. So, ma'am, now while you were talking about this concept of brachytherapy, there are two things which I would like to ask from my own as well. Like, as the brachytherapy is indicated only for the stage 3 cancer or even much more.
Any cervical cancer, even if it is stage 1B cancer, also if you are treating this patient with radiotherapy, will require brachytherapy. Okay. So cervical cancer, only 50% of the treatment will be done by external radiation, our MR, LINAC, or whatever kind of machines, IGRT techniques, IMRT, everything will be only 50% of the treatment with external RT. And 50% of the treatment is delivered by brachytherapy. So what we do in brachytherapy is these radioactive materials, like, and we are actually now specialized, and in fact, we have recently released a PO for MR brachytherapy also here in Hitec City here. So what we do here is we do insert all the active sources of, applicators. And once these applicators are within the patient's body, with that applicators, we do an MRI on the machine. Okay. So that MRI will tell us what is the residual disease, where all the disease is there. Okay. So, and then we introduce the radioactive needles exactly to the position where the MRI guides us. Okay. So after externality, maybe there is only 50% or 60% reduction in the size of the tumor. But if you leave that 40% or even 30% of the tumor, there are all chances that after a period of time, that disease will come back. So with brachytherapy, what we do is we try to do, a good brachytherapy procedure there by inserting all the radioactive needles directly into the tumor, whatever the residual tumor is there, under MR guidance, and then that is MRI guidance, and then treat those patients with that, radiotherapy, radioactive materials.
Yes.
So this chances, the chances of cure will be very high here. At the same cost, we are reducing all the side effects also for these patients. Yeah.
So, ma'am, very interesting, facts about this. And again, the second question which I wanted to ask is, like, a woman who is in her G1 gravida or confined, or she's into the stage wise cancer. What is the contraindication? Might be very contraindication. The steps are. So, what we do for those clients as well? The one who is
Sorry, I
conceived,
didn't get your question.
the one who is conceived, the pregnant mothers.
Yeah. That's a very
Maybe or gravida too, or somebody who's
yes.
been identified as
Yes,
cervical.
Shanti, that reminds me of very good examples in my own personal experience. So there are, chances that some patients, they do develop cervical cancer when they are pregnant, okay, around 35, because nowadays we see lot of, elderly primaries which are coming up after 40 or 45 years also, they come up with the first child, okay. So there are chances that these patients will also have a coexisting cervical cancer. So it all depends on which stage of cervix, which trimester of the pregnancy this cancer is detected. Okay. First trimester, we don't usually take any chance. Okay. We ask them to terminate the pregnancy, go for the treatment, proper treatment, and it all depends again on the family life, the patient's treatment choices and all. So then majority of the times we'll be seeing these patients in either second trimester or the third trimester. Okay. So in that pregnancy stage, your baby is also precious for you, right? So what we do is we give some safe chemotherapy drugs. Okay. There are certain drugs which can be given safely even to the pregnant woman.
Yes.
So the reason is that we want the disease to be arrested at that particular stage. Maybe for good reasons, it might reduce in the size of the tumor also, to control the tumor to that stage. And then once the baby is delivered, we do the proper radiotherapy for these patients. Because during pregnancy, we are not allowed to even take a single X-ray also. So there's no way that we can treat these patients with radiation. So this is what we do. So usually second trimester or third trimester patients, we give them chemotherapy, take the disease under your control, And then once the baby is delivered, you will go ahead with the routine
Okay.
treatment
Yes.
of external radiation, brachytherapy, chemotherapy, everything. Yeah.
Thanks for clearing the facts, ma'am. Yeah.
Yeah.
Over to you, Sonia.
Let's look into the emerging therapies. Different types of brachytherapies like intracavitary therapy and interstitial brachytherapy. Intracavitary therapy is used to treat cervical cancer. In this, the radiation sources are placed inside the body cavity, typically vagina, close to the cervix. It allows to deliver radiation to the tumor, minimizing exposure to the surrounding tissues.
Yes, ma'am.
Interstitial brachytherapy.
I think Madam has already spoken about this intracavitary. I think, Madam, we were talking about the internal radiation, which is again in a form of intracavitary and interstitial.
Yes. Yes.
And we go with the precise based guided radiation and target chemotherapy.
Yes. So basically, like it's the same thing what I have told you. Intracavitary is simple, like you just do it on an OP basis. Interstitial is a highly skilled procedure. Not every center has these applicators. Only very few centers in Hyderabad also have this. And we are very fortunate at Yashoda to have this applicator also with us. Okay, so interstitial brachytherapy is it's the state of art technology of as brachytherapy is concerned, because you have very high end equipment there which are MR compatible, and you insert the needles in the theater. Okay, so this is a very highly specialized procedure. You need to take up the patient into the theater, into the operation theater, and you have the ultrasound guidance there. Under the ultrasound guidance, you see wherever the tumor is there, you insert the brachytherapy needles into those, interstitial needles into those residual tumor wherever it is. And then you do an MRI also again after that and see the localization of the tumor and then treat that particular tumor. So that is the reason why, earlier when we were students 20 years back, we were having hardly 60 to 65% cure for cervical cancers if they are detected in stage 3 disease. But now with these kind of high-end technologies and highly specialized procedures and equipment, now we are able to give a highest possible cure up to 85 to 90% also if we do it properly and all in one. All the more reason to go for these techniques is that the amount of side effects what we have seen 20 years back is something which we are not seeing these days. Okay. Yeah, that's the best part of the evolving techniques what we have now.
So stigma about these therapies, I think, which is very clear nowadays to the public, and they are, reasonably they are opting out for your expert opinion.
Yes.
Ma'am.
Yes.
So, ma'am, the role of immunotherapy also does also have some impact on prevention part.
So basically for cervical cancer, it is mostly the external radiation along with the simple weekly cisplatin. That is more than enough. But there are chances that these patients after a few years may relapse. Okay. In those cases, we do give some immunotherapy, and this therapy is also supposed to prolong the disease-free survival for these patients. Yeah.
Now let's look into the assessment of brachytherapy. Pre-procedure preparations starts with preparing patient for brachytherapy, ensuring they understand the procedure, instructions on fasting and medications if any, and positioning of the patients. Intra-procedures. Here the nurse assists the radiation oncology team to support the patient, assist the patient in pre and post vital assignment and checking of the vitals and ensuring comfort and safety. Radiation safety precautions, ensuring that the protocols are followed, monitoring radiation exposure level not only to the patient but also to the staff, and proper shielding. Let's look into the post-procedure care. Post-procedure care starts with monitoring of the patient closely from complications like bleeding and infections, supportive care, managing symptoms, and addressing the concerns while recording of the recovery period.
So, ma'am, do you would like to give any of the teaching to the nurses who are posted in brachytherapy, like pre and post precautions, what they should be careful about, not only towards them, even for the patient as well?
Yeah. So For me, like I've been successfully running this brachytherapy program since a very long time. What I feel is the central and most important team member for this brachytherapy unit will be a nursing staff. Okay. And I'm so dependent on them. Unfortunately, I've been blessed to work with some very good nursing staff across all the institutes wherever I've worked till now. Starting right from Yashoda to Indo-American, then AOA, and finally now and back to Yashoda again. So we have a dedicated nursing staff in our brachytherapy units. So it's not like these people will go for a routine posting into other units and all. Once the nursing staff is there in that brachytherapy unit, they have to be there in that unit forever. The reason is that once a trained nurse is there, it's like a cakewalk for a radiation oncologist just to do the procedure, because finally the procedure has to be done by the oncologist there. But from there, the care of that patient, like in terms of watching for the bleeding or watching for the vitals of that patient, and then shifting those patients, because if a non-trained brachy nurse comes for that day, it is very difficult for us to for her to understand how to tie up that applicator to the patient's body, because it's a specialized procedure. It's not like any other nurse can come and assist you. Okay. So she also knows how to clean those applicators, because maintaining the applicator, these are very expensive applicators. Around each applicator will cost you around 50 to 60 lakh rupees also, each applicator. Just imagine the entire department, how expensive it will be. So maintaining the applicators and then sending them for a proper sterilization. And sometimes these needles, they do get blocked because of the clots. I mean, there is always a chance of bleeding in the patient. Okay. So these needles might get blocked, and how to take care of those blocks and how to sterilize these things are something which a nursing staff has a very pivotal role in running this brachytherapy unit. And I feel more than a doctor, it is her department who maintains that. We are just visitors there. We just go do the procedure, and then from there she takes care of everything. Yeah.
So yeah, right from the assessment of the patient, right from the mold room till the till they go out of
In fact, recently I've been, I mean, I had a brachy case in Second-Bed Yashoda. All our brachy patients we do there in Second-Bed. Okay. So the nurse there was so amazing, like you don't need to tell her anything. She knows everything, what applicator to bring, and how to sterilize that, but how to tie that applicator to the patient. Everything, she was like, I was just watching her how she was going to, do the procedure and all, but she was so amazing. I didn't need to guide her at all, because she has been doing this for the past several years. Okay. And I think we are really blessed to have such kind of staff in our hospital, so that because like we keep hearing some untoward incidences that some nurse has left this into the patient's body, or some doctor has done all these things. But all these kind of mishappenings can be curtailed only if we have a effective team, and the brachytherapy is all about a teamwork. And I feel the central team leader for this brachytherapy unit is our nursing staff itself.
Yes. So I think this webinar has been watched by Second-Bed nurses as well, as Madam has really told that the nursing vigilance is very much required in terms of maintaining these costly inventories and facilitating with the gynecologist and radiation oncologist. It is very important. Wow, kudos to the Second-Bed nurses. And we have come to the end of the session. Sonia, we'll just talk about the conclusion part and we are done.
So let's start with the prevention measures, that is visiting the doctor mandatory, safe sexual practices, regular screening, HPV vaccination, treating for pre-malignant lesions, if any, regular screening, including pap smear and HPV test, which can help us in detecting early stages of cancer.
So, ma'am, as per the conclusion, or as per, because in the hospital industry, every nurses are all of female gender. So, any conclusion note you would like to give to the healthcare professionals and workers and to the common public as well.
So what I would say is a nursing career is something which is a very noble profession. Okay. And because we clinicians will be busy with so many patients, but we are all so privileged to have you people in our team. Otherwise, without your contribution and without your support, it is impossible for us to take care of so many patients. And I think I mean, what I find in this hospital is the nursing staff are amazing wherever they are posted. And one good thing what I've noticed in this place is that nurses are not shifted frequently. Wherever they are posted, they're good in that work and they're good in that place. That's it. So they own the place. They own the place, and we feel like we're just visitors going into their own area and then supporting them whatever they want for that patient and all. It's amazing to work with this nursing staff here. So I'm so fortunate. I'm really happy. I think we need a feedback from them all. I mean, as well, what else they want from a clinician to make their lives better. Yeah.
Yes. So, yeah, thank you so much. That was very precise and very good webinar. We are going to end now. And we urge all the nurses, viewers, and learners not to neglect the reproductive health. Please seek the doctor's advice before you vaccinate yourself and stay happy and healthy. Thank you so much, for Madam, and thank you, Sonia. We end the session. Thank you.
Thank you. Thank you.
Thank you, ma'am.